In the stillness of the night, while the world outside rests, there is one organ inside our body that never sleeps. It beats with an almost supernatural precision more than 100,000 times a day. This small biological engine, the heart, is what keeps us alive. But what if, suddenly, it stops? A heart attack doesn't give prior notice. It doesn't knock on your door asking for permission to come in. It simply happens. Each year, millions of lives around the world are cut short by this silent and brutal event. But why does this happen? What lies behind this catastrophic failure of such an essential organ? The most powerful biological machine, the human heart, is a true marvel of biological engineering. It pumps oxygen and nutrient-rich blood to every part of the body, from the tips of the fingers to the brain. It is the center of the cardiovascular system, a network of arteries and veins, forming miles of invisible tubes working in harmony. To function properly, the heart itself also needs nourishment. Its cells depend on a constant flow of oxygen, delivered through specific arteries known as coronary arteries. When everything works as it should, the system is perfect. But even a small imbalance can trigger something dangerous. The invisible enemy, plaque buildup. Over time, especially with unhealthy habits, these arteries can accumulate deposits of fat, cholesterol, and other substances. This buildup forms what is known as atherosclerotic plaque, initially silent. This plaque clings to the inner walls of the arteries, gradually narrowing the passage through which blood should flow freely. But the danger isn't just the narrowing itself. Sometimes this plaque ruptures. When the body detects the rupture, it reacts as it would to any wound. It sends platelets to form a clot, but this clot can completely block the artery, cutting off blood supply to the heart muscle. When this happens, heart cells begin to die due to a lack of oxygen. The result is an acute myocardial infarction, or, as it's commonly known, a heart attack. Warning signs you shouldn't ignore. While a heart attack can sometimes strike without any noticeable symptoms, the so-called silent heart attack, in many cases, the body sends clear signals that something is wrong. Chest pain is the most well-known of these signs. A sensation of pressure, tightness, or burning, often described as if an elephant were sitting on your chest. But the pain doesn't always stay in the chest. It can radiate to the left arm, jaw, back, or even the stomach. Other warning signs include shortness of breath, even at rest, sudden cold sweat, nausea or vomiting, dizziness or fainting, extreme fatigue, especially in women and the elderly. Ignoring these signs can be fatal. With each passing minute after a heart attack begins, more heart cells die. Time, quite literally, is muscle. The risk factors you can control, but why are some people more prone to heart attacks than others? The answer largely lies in lifestyle choices. High blood pressure forces the heart to work harder than necessary. High cholesterol directly contributes to plaque formation in arteries. Smoking damages blood vessel walls and reduces the amount of oxygen in the blood. Uncontrolled diabetes negatively affects artery function. Physical inactivity and obesity increase the heart's vulnerability. Chronic stress, often overlooked, is also a silent enemy of the heart. All these risk factors can be controlled or improved with consistent changes in daily life. What to do if you suspect a heart attack? At the first sign of a heart attack, the immediate action should be to seek medical help. Fast response can save lives. Hospital tests like an electrocardiogram and specific blood tests are used to confirm the diagnosis. If an artery is blocked, the most common treatment is angioplasty procedure, where a small balloon is inserted through a catheter to open the clogged vessel. In more severe cases, bypass surgery may be needed, where veins from other parts of the body are used to reroute blood flow around the blocked artery. Prevention is the best medicine. Despite all the advances in medicine, nothing is more effective than prevention. And prevention begins with simple yet powerful choices. 1. Eat smart. Prioritize fruits, vegetables, whole grains, nuts, and omega-3 rich fish. Cut back on ultra-processed, fatty, and sugary foods. 2. Move your body. At least 30 minutes of physical activity a day. Walking, dancing, swimming, weight training strengthens the heart. 3. Say no to smoking. Quitting smoking drastically reduces the risk of heart disease. 4. Sleep well. Lack of sleep raises blood pressure and stress levels. 5. Manage your emotions. Practices like meditation, deep breathing, creative hobbies, and quality time with loved ones help keep the heart calm. A strong heart begins with small changes. You might be reading this and thinking, but I don't have time for the gym, or I can't give up soda. The answer is simple. It's not about changing everything at once. It's about changing one habit at a time. Take the stairs instead of the elevator. Choose a piece of fruit over a sweet. Breathe deeply in traffic instead of getting stressed. Small actions, and more importantly, they save hearts. What if the attack comes silently? In a surprising number of cases, heart attacks occur without chest pain, without any classic symptoms. This is what doctors call a silent heart attack, and it accounts for about 20% of all cases. Often, it's only discovered weeks or months later during routine checkups. That's why regular medical checkups are essential, especially for those with risk factors. Ignoring the signs, even the subtle ones, is a dangerous gamble with your life. You are the guardian of your own heart. The heart is more than just an organ. It is the symbol of life, emotions, and connections. It beats in rhythm with our choices. And while science has come a long way, the responsibility of taking care of it still lies, in large part, with us. So, the next time you think about skipping a workout, overindulging at a meal, or carrying the weight of the day's stress to bed, remember, every choice counts. Because when the heart speaks, it's best to be ready to listen before it stops speaking forever.